to meet you here. During today's lecture, I will briefly explain about another common health condition, which is the Parkinson disease. Parkinson disease is a brain disorder which affects normally the older adults, above 50 years of age. However, young people could still suffer it. Among the whole world population, around 10 million people suffer from Parkinson, and men has 1.5 times higher risk than women to develop this condition. Because Parkinson's disease increases with age, so most people suffer from it are over 50 years of age. However, 4% of people with Parkinson are still younger than 50 years of age. Now let's have a brief look about the pathophysiology. So what happens with the brain when people suffer this condition? Now in the middle section of the brain, there is a region called the substantia nigra. Substantia nigra is responsible to produce a neurotransmitter which is called the dopamine. And dopamine plays an important role in transmitting the signals between neurons in the brain. Now for Parkinson people, the substantia nigra could not release enough dopamine. So dopamine level reduced, and there's not enough production of dopamine. Now dopamine is very important. When we say neurotransmitter, that means dopamine helps the neurons in the brain to send message to each other properly. Now in the brain, we have like millions of neurons, and the neurons need to connect with each other and send a message to each other to help the brain to process information. So dopamine helps the two neurons to send the signals properly. So if there is a reduced amount of dopamine, the signal could not be properly delivered between the neurons, and then the brain function will be affected. So brain cannot properly process information. So, and dopamine plays really some important roles as well. Now dopamine, the main function of dopamine is that it maintains a balanced movement. It helps people with the motor function. It helps people to mobilize properly, to keep balance, and to move, to have a balanced movement, to move arms and legs properly. However, if dopamine actually level is really low, now their movement will be affected. So with Parkinson people, they actually have really rigid and stiff movement. They cannot properly move their hands and legs. They cannot properly walk like normal people. So they need a lot of assistance. Now they also have very shaky hands, shaky the limbs, shaky hands, shaky leg, and they cannot keep still in one position. So their hands can be very, they can have like frequent tremor and frequent shaking movement. So this is a main symptom of Parkinson. And also, dopamine also can help people to keep happy, maintain a sense of pleasure, concentrate, sleep well, have a good memory, have a good ability to learn new things. So all these like functions, dopamine actually can help the body to do. Now, so if dopamine level is low, now people could have like poor mood, so can feel depressed, have trouble with sleeping, have less motivation, less concentration, lose the ability to learn, and also lose memory. So they are all these symptoms can come on. So Parkinson disease is because the dopamine level reduced in the brain, so triggers this series of symptoms. And the most important symptom is the stiffness and the rigidity of movement, and problem with walking, balancing, problem with like keeping a nice position, and also have this frequent tremor and shaky movement of their hands and legs. Yeah. Now, if people suffer from Parkinson, how can we treat it? Now, firstly, now we have to seek doctor's treatment. Now, doctor needs to prescribe medication to increase the dopamine level in the brain. Now, this one common medication is called the levodopa. So levodopa is a main medication prescribed by doctor to help the substantia nigra to produce more dopamine, to increase the dopamine in the brain. So really, like patients with Parkinson really need to remember to take medication on time. If they miss a dose, it could result in the symptoms coming back. And also, like we can try some other natural strategies to increase the dopamine naturally. So for example, we can consume the food which is rich in protein. Now this food include the beef, beans, eggs, dairy products, milk. Also we should like consume less saturated fats. Now saturated fats is mainly found in the animal fats or the butter or the oily foods. So we should restrict the amount of saturated fats and also also eat less processed foods as well. So so eat more fresh vegetables, fresh fruits, but don't eat too much like processed foods. We can increase the probiotics in our diet. Some certain types of yogurt contains the probiotics and it could helpful in increasing the dopamine. Apart from the diet, we can consider other strategies like maintain a good level of exercise. So regular exercise can help the brain to release more neurotransmitter, to release more dopamine, to help the brain to function better. Have enough hours of sleep, listen to music, enjoy more sunlight. Now the research shows that sunlight could help the brain to release different types of the chemicals, neurotransmitters. Now, including the dopamine, also the serotonin, also endorphin. So serotonin, endorphin, dopamine, they are all the neurotransmitters that exist in your brain to help you to maintain a good mood, a balanced mood. So sunlight can actually triggers your brain to release these chemicals and can make you feel happy and relaxed. Also, you can take like supplements like take enough like vitamins, nutrients. Now they could also help to produce enough dopamine in the brain. So that's the whole lecture about this condition. Now hopefully you can have a better understanding now. Thank you everyone.